Today we will be discussing healthcare in Germany. We hope you guys enjoy.
The person that we chose to interview is Sophie Scheidt, who is a good family friend of mine. Sophie is 19 years old and was born and raised in Trier, Germany. She currently still resides there. We interviewed her over the phone, which is how we got most of the information, but asked her to send a few videos explaining topics that we felt were the most important.
Here are some fun facts about Germany. It became an independent state in 1871, but became a modern country in 1990 when West and East Germany were reunited. Berlin is the largest city in Germany with a population of 3.65 million. And it is the 7th largest country in Europe, covering an area of 357,022 square miles.
Here are some German demographics. The total population is 82.7 million people. The life expectancy for females is 84.1 years, and for males is 79.6 years, and Germany has 140,000 uninsured compared to 44 million in the US.
When people think of Germany, things like beer and Oktoberfest are what typically come to mind. In fact, it is estimated that the average German consumes around 140 liters of beer per year. While both of those are huge parts of the German culture, there is much more to be talked about. While we refer to the country as Germany, Germans themselves call it the Dutchland. Over 95% of the population speaks German, but there are also a variety of minority languages that have been recognized due to the large immigrant population. When it comes to religion, 29% identify as Catholic, 4.4% as Muslim, and around 13% Jewish.
We will now share some key healthcare information that you should know about Germany. Here we have the system name in German, which I will not be pronouncing today. Now, how do Germans get the care they need? Well, they have a card that they use for healthcare, much like the Carte Vitale in France. An example of Sophie's is shown here on the right. We can see the front and the back. They simply present this card to their healthcare provider and receive the care they need at any public hospital or clinic. Where does this money come from, and how does the pay split up? So the money required to go towards your health care, and it can vary, goes into something called a health fund that is split between different companies. 14.6% of pay is split into 7.3% each, so the employer and employee pay the same amount in the end. There are 3 types of health insurance, and Sophie will explain those in the video that is coming next. Furthermore, everyone receives health insurance, and it is a requirement in Germany to have health insurance. You get it from being employed, so if you cannot be employed for some reason, one of the issues is figuring out how to get health care. For example, if you cannot afford the contribution or your retirement prevents you from working, this is one of the major issues with Germany's Bismarck model. However, the wealthiest families are excused from this insurance mandate. And finally, how much do Germans spend on healthcare every day? They spend 1 billion euros, which of course is the equivalent to over $1 billion in the US. Now the next slide is going to show a video of Sophie, our interviewee who lives in Germany, and she is going to explain more about the healthcare card.
As you know, in Germany there are 3 different types of health insurances that you can get. The first one is public health insurance, the second one is voluntary health insurance, and the third one is private health insurance. And no matter what type of health insurance you choose or you can afford, you will get a so-called health card. In German it's called Gesundheitskarte. And this card has all your personal information on it. For example, on the front, you have your full name, the name of your insurance company, and your personal insurance numbers. And on the back, you have your full name again, together with your birthday, your identification number, the identification number of your insurance company, the identification number of this card, the expiry date, and your signature. And that's all you need and all the doctors need to know, and that's all that is on this card. You always should have with you when you go to the doctor.
The funding of healthcare is done a lot differently in Germany. Governmental insurance is provided to every citizen and covers about 88% of the population. This free healthcare is covered by a health fund that is contributed to by the employee, employer, additional income-based contributions, and general tax revenue. All of the money that is put into the health fund is then split among 109 different insurance companies and is used to pay the bills. Secondary insurance or voluntary insurance can be supplementary or complementary policies, and it covers the small things that the governmental insurance does not, like copayments and hospital stays. High-income individuals can opt out of governmental insurance for private insurance, and this covers about 11% of the population. This comes with additional premiums, but allows access to more services in private hospitals. And in the next video, Sophie will talk about access to healthcare in Germany.
So going to the doctor in Germany is different from going to the doctor in the US because in Germany you make your appointment, you go there, and the first thing the employees will ask you when you arrive there is if you have your health card with you, and you should always have your health card with you because some employees say, well, I'm sorry, but if you don't have your card with you, we can give you no service. And some employees say, well, okay, we're not really allowed to give you any service now because you don't have your card with you, but come back tomorrow and show us your card and then it's okay. But very few employees do that. So you give them your card and they run it through the computer so they can see when was the last time you were there, and they can see all your personal information they need. And if that's done, they give you your card back and you go to your appointment, and after your appointment is done, you say goodbye and you leave without paying anything. And I know that in the US, you have to pay for the service they just gave you. And, in Germany, that's different because you don't have to pay anything because you have your card. And you don't have to stand there and pay for the service.
The training and education of healthcare professionals in Germany is similar to the US. Doctors have to go to a university and study medicine. If they attend a public university, their education is free, and students go straight from high school into the medical program. They have 2 years of didactic and 4 years of clinicals. They must pass 3 board exams, and doctors are very well respected in Germany.
The typical diet in Germany is far from healthy. Most of the time, meals are heavy, starchy, and full of meat. Because of this, the people of Germany tend to have health issues such as high cholesterol. While most hospitals in the United States seem luxurious, in Germany, that is not always the case. Instead of being the most luxurious, they value healthcare quality and providing the best care they can. Something that I found to be interesting was that people in Germany believe that spending a few days at the spa once a year can prevent sickness. And lastly, about every 10th patient is an immigrant, meaning that providers have to look into the fact that almost all patients have different risk factors. This changes the way in which a provider gives care.
Tobacco was the #1 health risk factor for death and disability in 2017, followed by hypertension, which affects 1 in 3 people. A third of the population reports that they partake in binge drinking regularly, and all of these can lead to serious health issues.
Many health disparities seen in Germany are ones that are also faced in the US. However, the disparities are a lot less prevalent. In a recent survey, only about 0.3% of the population in Germany said they had unmet needs for medical care. For example, in poorer cities and more rural areas, there is a lack of access to treatment and preventative care, which often leads to chronic illnesses like diabetes, heart disease, and depression. And this creates a large difference in life expectancy, sometimes as large as 13 years. Several social determinants of health are also very prevalent in poorer cities, like a lack of access to healthy food and places to exercise. Also, citizens in these poorer cities have little money to spend on healthcare extras and less time to get the care they need. Here are our sources. Thank you for listening and learning about the healthcare system in Germany.